Hello, I'm Dr. Rachel Hall of Evolve Dental Healing, Holistic Dental Practice in Kenmore, and this is another episode of Exposed Teeth. And today I'm going to be talking to you a bit more about amalgam removal, what the process is like and what to expect. And I've discussed in previous episodes about the dangers of amalgam, the fact that they contain mercury, and the impact that that has on your health. Now, I'm a holistic dentist. I've been in practice for 26 years and I've had my own business for the last 13. And in that time, I've removed something like 16,000 amalgam fillings from people's teeth and helped thousands of people to have mercury-free mouths and healthier lives. Now, one of the reasons people come to get amalgam fillings removed is, well, the main reason they come to get them removed other than cosmetic is that they're concerned about the mercury content in those fillings. And what happens is dentists are trained that once you've mixed the amalgam, which is a mixture of silver, copper, tin and 50% mercury, that mercury, which is a toxic heavy metal, is somehow now safely bound within the filling. Yet any scraps of amalgam filling can't be disposed of in the garbage or down the waterways because it's now considered toxic waste material. So there's a bit of a mismatch there for me that you can say it's toxic over here, it's toxic over here, but once it's in your teeth, it's somehow safe. So the mercury from the filling does vaporize under heat and friction. If you're having hot drinks, fizzy drinks, grinding your teeth, or even just brushing your teeth, you'll get mercury leaking out of your fillings. So a lot of people come to have them safely removed so that when we drill them out, they're not ingesting any particles from the actual amalgam or swallowing bits of filling or inhaling the vapor. So is the amalgam removal difficult? Well, the process itself is quite straightforward. Just like any other dental procedure, we numb your mouth to make sure you're comfortable. We're going to use our dental drill and then we're going to take the filling out and put a new filling in. The difference is when you have that done with a holistic dentist is that we're also going to use very strict safety protocols. Now, this is done to ensure that we minimise your exposure to any mercury that is released at the time, and also to protect ourselves from any mercury vapor, because you can imagine we're doing that day after day after day for many, many years throughout our career. So essentially once you're numb, what's involved is we use a barrier sheet that goes over your mouth to prevent any ingestion, swallowing or inhalation of the amalgam mercury fragments. So that has some little holes made that allow your teeth to specifically come through. We can work on those teeth and the bits will go onto the sheet and get washed up and collected in our suction filters. So we want to make sure that you're not going to be splattered with bits of the filling because your mouth's highly absorbent. I don't want you to swallow any bits either or breathe any of those fine particles in. So that sheet covers your mouth but not your nose, and so you can easily breathe and swallow normally during the process. And actually removing the filling from your tooth does not take that long because we have special drill bits and techniques to get that out of the way. So as we're drilling, that's creating a lot of friction, which is going to vaporize mercury. So we want to make sure that you don't breathe that in, neither do we. It's not going up in the air and polluting the atmosphere. So we have a special filtration or ducting machine, and that has a trunk that sits out in front of your chin. And that's going to draw away the mercury vapor to ensure no one in the treatment room is inhaling this potentially highly toxic substance. As an additional precaution, we're going to provide you with a separate air supply. So we provide you with sterile air via a little nose hood that just sits over, and as you know, that is turned on and the air's coming through and you're breathing that clean air. So there's nothing that can accidentally be inhaled into your body. For us as the dental team, we wear mercury respirator masks for our own safety so that we're not inhaling any mercury vapor or any of the particles as well. So Evolve Dental Healing, any amalgam filling that needs removed is done with SMART protocols, and that means safe mercury amalgam removal technique. But if we're going to do a amalgam removal, so we're going to actually electively remove all the amalgams from in your mouth, we will only ever do this after an extensive consultation and a comprehensive dental examination, where we need to do a full mouth checkup, take dental x-rays where indicated, do a full assessment of your dental health, your bite, your gum health. We're going to look for any inflammation, infection, decay and dental disease, and also look for any hidden amalgams that might be under your white fillings, because it's not uncommon to have a white filling but there are still residual bits of mercury filling underneath there. We're also going to discuss your overall health and your health history, because we need to know what's going on with your body. Are you well enough to cope with the process? How big are these fillings? Where are these fillings? How many are we going to do per session? And how far apart do we need to space those sessions? What do you need to do an at-home detox and look after your body? Do we need to liaise with your GP, a naturopath or a nutritionist to help support you to be ready for the process? So it's important that for anyone who's undergoing dental amalgam removal, that you support yourself with a nutrient-dense diet and specific supplements that are taken in the lead up to the process, so before it, during, so whilst those amalgams are being removed and the intervals in between them, and for a period after the amalgams have been replaced, because your body's going to be actually detoxing itself from mercury. So it's essential to assist your body to be able to cope with that and maximise the benefits of treatment. So as I was saying, for many patients, we're going to liaise with healthcare practitioners to best support you through the process. And we can also recommend highly qualified practitioners to support you with mercury detox and heavy metal removal. So essentially, is amalgam removal difficult? Well, no, it's no more challenging than any other dental appointment. And look, I know that for a lot of people, dentistry makes you nervous, it makes you quite anxious. I'm not the best on the receiving end as a patient, and we just have to learn how to manage you and your teeth and the appointment so we can best support you to get the end result, which is to have an amalgam mercury-free mouth. So if you're going to ask me a question, ask me something like, is amalgam removal important? And I'm going to say yes. If you care about your health, then I definitely think so. So it's not a difficult process. It's just taking the time to understand you, your health, what's going on in your mouth, to plan the process accordingly, to ensure we look after you safely, and to maximise the mercury detox that can happen in your body. So thank you very much for watching. This is Exposed Teeth. We're going to have a break for a couple of episodes now because I've got some courses and training coming up. But if you'd like to know more about amalgam removal and the impact of mercury, then feel free to reach out to me. You can ask in the comments, you can private message me. Please share these videos. Let's get this message out there. And if you want to book in for a consultation, then you just give us a call on 3720-1811 and my friendly and helpful team will be delighted to organise that for you. So thank you once again for watching, for investing the time in getting to know about your teeth and your dental health. I'm Dr. Rachel Hall of Evolved Dental Healing, and this has been Exposed Teeth. Thank you.